This is Dr. David Allen, and I'm talking with Dr. KirkChristie, an expert in addiction. And he's telling us about the problems and maybe the vulnerability of the Bahamas to an opioid or narcotic epidemic. In the last segment, he talked about synthetic marijuana, and you mentioned also fentanyl.
Yes.
And there's a synthetic fentanyl as well?
Yes. It is a very popular drug among drug pushers because 1 pound of powdered fentanyl can fetch a whopping price of $1 million on the market if it is cut.
Say that 1 pound of...
Yeah, 1 pound of fentanyl can fetch an asking price of about $1 million. And that is for the powder, which can be cut and blended and sold on the black market. Also, if it is cut and produced, and pills are produced, 1 pound of fentanyl, synthetic fentanyl, which costs about $12,500, can fetch a whopping price of about $80 to $90 million on the black market. And usually the 1 tablet of synthetic fentanyl can sell anywhere between $20 to $80 for 1 pill of synthetic fentanyl. The danger with synthetic fentanyl is very potent, and it is 100 times more potent than morphine. It can suppress the respiratory drive in human beings. It makes it very dangerous, especially in the novice user who is using it for the first time and does not have tolerance to the drug. They can die almost immediately. The lethal dose of synthetic fentanyl is approximately 2 or more milligrams. The minimum lethal dose, 2 milligrams. It is used, there is the legal fentanyl that is used in the emergency room and for surgical procedures, and usually the medical dose of the legal or illicit fentanyl is 1 milligram, less than or equal to 1 milligram. The difficulty with the drug pushers and drug peddlers, they are not cutting the fentanyl appropriately. So there's something called a chocolate chip effect, where they ought to mix the synthetic fentanyl in 100 to 1 parts. If they cut it with cocaine or cut it with heroin, it should be 100 to 1 in terms of the dilution. But because of the chocolate chip effect, you may have a batch that has more than the acceptable or the non-lethal dose of synthetic fentanyl, and a lot of people are dying because of overdose in the emergency room. Now, in persons who have chronic fentanyl or chronic opioid use disorders where fentanyl is a preference, they have tolerance, so their respiratory drive will not be arrested if they use synthetic fentanyl for the first time or they're using it on a regular basis. But the novice user who's using it for the first time or the drug-naive user can die, and because the respiratory effect outweighs the anesthetic effect with respect to fentanyl. Very dangerous drug. Certainly we don't need this drug in the Commonwealth of the Bahamas, and we need to educate young people about synthetic fentanyl to not try it, not even once.
Dr. Christie, in the war against cocaine, in one sense, people can just smoke that or whop that, as they would say. But what protected us from the heroin coming along with the cocaine was that most Bahamians, particularly Bahamian men, are terrified of needles.
Yes.
But what you're saying with this new type of narcotic,
yes,
it's really in pill form or rubber form or gum form.
Powder.
And so you don't need the needles anymore.
You don't need the needles anymore. And the marijuana can be smoked. The synthetic marijuana is smoked in a repeater paper, just similarly to the plant marijuana. You can put it in a pipe, which makes it very appealing to young people. And also synthetic fentanyl can be taken in tablet form and also powdered form. It can be cut with cocaine, and that's the danger. That now the drug pushers are cutting it in cocaine and heroin to amplify the euphoric property, the euphoric property of the drug. But in the novice users, they're dying. Canada is having some problems with this now, with novice users or persons who unwillingly or willingly took cocaine but were unaware that it was cut with synthetic fentanyl.
When you say cut with it, fentanyl was mixed in with it.
Yes, fentanyl was mixed in to amplify the euphoriant. But because of the chocolate chip effect, where the drug pushers have difficulties with the dilution process, with the mixing process, they cause overdose of these individuals and death. Persons have died who've gone into the emergency room. And Narcan will not bring them back, especially in the novice user, so they can die even with the antidote with respect to synthetic.
Dr. Christie, we have very porous borders and people are coming and going in our country all the time. How are we going to stop this epidemic from coming here if it's already in America?
Well, Dr. Allen, I believe knowledge is power, and we have to all equip ourselves with the hazards of drug use, especially with respect to plant drugs, such as marijuana, with also the illicit drugs and prescription drugs. We have to educate ourselves about the deleterious effects of these medications, especially in off-label use. And persons who do have prescription drug use disorders and or opioid use disorders, specifically, there's help. There's help currently in the Bahamas, and you can get help here, both publicly and even more so privately, with our program at Rejuvenate Bahamas. And we have a medication-assisted therapy with the Suboxone, which is the buprenorphine naloxone combo.
Say a word about Suboxone. What is Suboxone?
Yeah. Suboxone is a wonderful medication. It is a high-potency opioid drug, but it is used to switch persons off the drug that they are misusing. And we have very good preparation of this drug now in the Quicklit tablets. So the tablet is put underneath the tongue, and it dissolves. And
what dose?
Quick immediacy.
What dose to use?
The maintenance dose of Suboxone is 16 milligrams, and it comes with a 4 milligram of naloxone, which prevents the user from injecting, because you have some individuals who may be tempted to dissolve the Quicklit and inject it, which will have high potency and a lot of amplified euphoric properties. But in the control environment at our treatment facility, we give it sublingual underneath the tongue, and we observe the patient for a period of time for
And
on
what's the
average
role
8
of the
hours.
naloxone, the 4 milligrams of naloxone?
The naloxone prevents the individual from injecting the buprenorphine into their veins. It also diminishes the withdrawal symptoms of opioid, which could be jitteriness, anxiety, also the diaphoresis, the sweating, excessive sweating and yawning, and being on and odd. It diminishes those withdrawal symptoms, which can appear within 12 to 16 hours after the last dose of the medication. So it's a very good preparation that we use in the office now as an outpatient basis.
This is very interesting, fellow Bahamians, because Dr. Christie was the first one to bring Suboxone here. What was it like organizing that?
Yes, like I said, we had an earlier show last year, and it was a dream of myself, Dr. John Dillett, and obviously pioneering psychiatrist you, Dr. David Allen, that inspired us, and others in the community in public practice that inspired us to bring a drug treatment facility here as an alternative to the public hospital. And we wanted to bring something, a place where persons would feel comfortable. There would be confidentiality, full confidentiality and anonymity. And that is available at Rejuvenate Bahamas at Suite 210, Sandy Port Plaza. If you have any concerns or further questions, you can reach me at 327-3633, 327-3634, or just send an email to me at info@rejuvenatebahamas.com, and I'll be more than willing to answer your questions or concerns.
And Dr. Christie, who should come to Rejuvenate? How does a person know that you are available to help them? What type of patients do you take at Rejuvenate?
Yes, at Rejuvenate Bahamas, we treat persons with moderate to severe and also mild opioid use disorders and other drug use disorders, such as alcohol use disorders, marijuana use disorders. And if you are having difficulties where you're having active symptoms of withdrawal, we can bring you in as an inpatient to our rehabilitation center. We can stabilize you, and we can give you the talk therapy and other holistic treatments that you need to re-enter society. And so we are here for you, and it is a comfortable environment. Rest assured, we will ensure confidentiality and anonymity. So you can contact me on that same number, 327-3633, or 327-3634, or inbox me at info@rejuvenatebahamas.com, and I can answer your questions and set up a consultation with you and or your loved one.
And Dr. Christie, if somebody has an opiate addiction, what's the process of treatment, for example, when they come to your unit, your private unit?
Yes. Based on the severity of the opioid use disorder, two things can happen. We can withdraw you on the Suboxone over a period of 72 hours, where we will bring you in a precipitated withdrawal state, where you would have some anxiety, some jitteriness, and about 2 to 3 symptoms of the opiate withdrawal. And we can start the Suboxone at higher doses than usual, and where it would be initiated on day 1. On day 2, it would peak, and then we would give you a lower dose on day 3, and then we would monitor you for a period of time and then discharge you from the treatment facility. The second option, in cases of moderate to severe opioid use disorder, where the person is susceptible to withdrawal, to opioid withdrawal syndrome, we would put you on a maintenance treatment with Suboxone for a period, minimum time of 5 months, and then we would do a taper in the 6th month over 30 days to get you off of the buprenorphine, which is the Suboxone. Now, we can continue on with the maintenance therapy of 16 milligrams per day based on whether or not you're having cravings to the drug that you prefer, and it can even last beyond 1 year. We can put you on indefinite maintenance treatment if you feel as if the risk factors are too much in your community, where you're having accomplices who are using, or your consorts, or you feel as if you do not have the support in the community. We can keep you on indefinite maintenance therapy on the 16 milligrams of Suboxone.
So after they start the Suboxone, they can withdraw from the opiate.
Yes.
And stay on that for a period of what, 3 to 6 months?
3 to 6 months.
And
then
if
we
they
would taper
can't make it off the Suboxone, they could be on
indefinitely. We could keep them on
lifelong maintenance.
Lifelong maintenance. We can keep you on. Of course, we will have regular follow-up with you every 2 to 3 months, and then you would have to continue to follow up in talk therapy. And we have pioneering psychiatrists. You have your specialized talk therapy. We also offer cognitive behavioral therapy, and we have holistic treatments in terms of teaching you about recreational therapy, music therapy, sound therapy, art therapy. Those can be provided for you as well.
And Dr. Christie, does the person have to always be an inpatient, or this treatment can be done as an outpatient?
Yes. If it is mild to moderate opioid use disorder, it can be done as an outpatient. So we will bring you in for a period of 8 hours per day, and we can do the switch. We'll switch you off of the drug of preference, whether it be Percocet, Tylex-3, Tramadol, Vicodin, hydrocodone, morphine, MS-Contin. We can do the switch. If it is moderate to severe, we may be apt to keep you 24 hours for a period of time for surveillance of your vital signs, and to ensure that you do not go into any withdrawal syndrome, which can be really uninviting and really unpleasurable if you in marked withdrawal.
We're going to take a break and be